Welcome to Chapter 9, Supportive Healthcare. These are the learning objectives. Identify symptoms of common infectious diseases in early childhood. Outline criteria for exclusion from care. Describe considerations for caring for mildly ill children. Recall licensing requirements for handling medication. Explain communication about illness between families and programs. Title 22 Regulations outline key responsibilities for early care and education programs. Programs must report certain illnesses to the local health department. When a child becomes ill, families must be notified immediately. Programs must also be equipped to isolate ill children. For infants, isolation areas must be under constant visual supervision. A program cannot administer medications without written approval from the child's authorized representative. Children in early care settings experience illness frequently. The most commonly reported symptoms include runny noses, coughs, fever, vomiting, diarrhea, earaches, and rashes. Interestingly, while respiratory symptoms are the most common, it is actually rashes and gastrointestinal illness that lead to the most absences from care due to stricter exclusion policies. The common cold is caused by over 200 viruses, with rhinovirus being the most frequent. Influenza is more severe and comes on suddenly. It can lead to serious complications, such as pneumonia and sepsis. The annual flu vaccine is the best prevention tool available. Neither condition requires automatic exclusion. The key question is whether the child feels well enough to participate and whether staff can adequately care for them. Sinusitis occurs when fluid builds up in the sinuses, causing congestion, facial pressure, and headaches. Most cases resolve without antibiotics, and children do not need to be automatically excluded. Sore throats are common in early childhood. Viral sore throats typically resolve on their own without antibiotics. However, strep throat is bacterial and requires antibiotics to prevent serious complications like rheumatic fever. A child diagnosed with strep throat must be excluded until they are fever-free and have completed at least 24 hours of antibiotic treatment before returning to care. Ear infections are very common in young children. Middle ear infections may resolve on their own, but severe cases need antibiotics. Head lice are spread through head-to-head contact and are a common concern in early childhood settings. It is important to know that both the American Academy of Pediatrics and the National Association of School Nurses recommend against no-nip policies. Children with head lice do not need to be sent home early. They can finish the day, be treated, and return after treatment has begun. Not every illness requires exclusion from care. The key criteria are whether the child can comfortably participate and whether staff can adequately care for them without neglecting other children. Programs should be prepared to care for mildly ill children, those who do not meet exclusion criteria but may need extra attention. Staff should ask themselves whether they can manage the child's needs without compromising care for others and whether there is a quiet space for the child to rest. Call 911 right away if a child has a stiff neck with fever, experiences a first-time seizure, has blue or gray skin, is unresponsive, or is vomiting blood. These are signs of potentially life-threatening conditions that cannot wait for a parent to arrive. When programs choose to administer medications, they must follow specific licensing requirements. All medications must be stored safely out of children's reach, properly labeled with the child's name and date, and administered only with written permission from the authorized representative. Some diseases are serious enough to require mandatory reporting to the local health department. These are organized into 3 categories based on urgency. Clear communication with families is a critical part of supportive healthcare. When a child is excluded, programs should provide written documentation that explains why and what needs to happen before the child can return. When children are exposed to a communicable disease, families must be notified with information about the illness, how it spreads, and what to watch for at home.